This video is part 3 of Chapter 2, Neuroscience for PSY 110S, the Psychological Sciences. In this section of the chapter, we're going to start by laying out the organization of the nervous system, and that includes the central and peripheral nervous systems, and then the parts that make those up. So the central nervous system is made up of the brain and spinal cord. The peripheral nervous system is everything basically outside of that. The peripheral nervous system is divided up functionally into the somatic system, which brings in information from the outside world, and as well as outgoing commands that come from the brain to the muscles that you use to move around in your environment. The autonomic nervous system is responsible for things inside the body. So, regulating the things like your heart, your stomach, your whole digestive tract, all of those things. Within the autonomic nervous system, it's broken down into two types. The sympathetic nervous system is that fight or flight system that is designed to govern your physiological response to arousal situations. So, think of that time when you have to slam on your brakes to avoid hitting another car. Your fight or flight system is going to ramp up and become more aroused so that you will be capable of dealing with the emergency. The parasympathetic nervous system, sometimes referred to as the rest and digest system, pulls you back. So after your sympathetic nervous system has been ramped up in an arousal situation, the parasympathetic nervous system is responsible for bringing you back down to stasis, or to what your authors refer to as a resting state. There are a couple of broad types of neurons in the nervous system. There are lots of different types of neurons. Your authors are going to focus on two broad types. Interneurons have an integrative function within the central nervous system, and their job is to communicate with each other. So they're in the central nervous system. They're going to be those linkage points where they're bringing in sensory information or sending out motor information and instructions in the spinal cord. So you can kind of think of them as connecting branches between primary systems like in the brain and the rest of the body. Sensory neurons carry specific information to the central nervous system from your receptors in your eyes, your ears, your tongue, where your taste buds are, your nose, the sensory systems for olfactory, for smell, but also from your muscles. You have sensory neurons within your muscular system that help you to understand where your body is positioned in space. Without those sensory neurons in your muscular system, things like standing, walking, being able to maintain position would be extraordinarily difficult to do. You also have sensory neurons in glands because they have to be triggered to release or withhold. Motor neurons are specific to carrying commands for movement from the central nervous system to the rest of the body. So say, if you think to yourself, I'm going to move my left hand and place it flat on the table, your brain will send messages through those motor neurons so that you can enact that command. When the motor neurons are destroyed, or when disease affects them negatively, that can interfere with your capacity to carry out those commands. So let's go a little deeper into the central nervous system. As you already know, the CNS contains the brain and the spinal cord. In this image, you can see the kind of layout. The pink in this particular image is the central nervous system. The yellow in this particular image is the peripheral. So I think looking at that picture, it you can see why they're using the words central versus peripheral. The brain and spinal cord create that up and down conduit, whereas the peripheral nervous system branches out into the rest of the body. The spinal cord is essentially a big highway for both incoming sensory data and outgoing commands for movement and so on. It's also a place where, we can track what are called spinal reflexes. So, when you go to your doctor and they do that little hammer test on your knee, and your leg will fly out without you telling it to, that's a basic reflex. As you know already, the brain is the central control system for the nervous system. It would be inaccurate to describe it like as a some sort of supercomputer. For the most part, that would be inaccurate. It's a useful metaphor in the sense that, yes, your brain is going to have all of the information that's necessary to interpret incoming sensory information and to send out instructions for what to do. It is, though, a very changeable system. As you interact with your environment, I think one of the videos I showed in an earlier section of this chapter, it was stated that as neurons fire, the more often they fire, the better they get at doing that. And the messages that they send chemically through neurotransmitters, there become more receptors for them. So it's like the commands that you use all the time are going to have the most well-worn pathway, and they're going to continue to be used. So, for example, if you learn a new skill, like if I went out today and said, I'm going to learn how to hit a golf ball, never going to happen. But just let's say I did. It would first be very, very intentional, because I'm literally laying down new pathways, new motor pathways, new memories, new kind of experiences, new feedback coming from my muscles, from my sensory systems, from eyes, ears, and so on, that all have to be integrated. So at first it's going to be very cumbersome. Lots of errors, lots of confusion, lots of my body just trying to figure it out, my brain trying to figure it out. Over time, if I stuck with it and continued to practice and get more feedback, it would get faster and faster and more ingrained and more easier to do without a lot of excessive thinking. The peripheral nervous system is responsible for pulling in information from the external world. So a lot of this is sensory information that we need to then later interpret. So you have, as it says in this image, you have a lot of, a whole map worth of nerves. One of my kids is in a physician assistant studies program right now, and she has to learn, how to find these physically in the body, in her anatomy and physiology lab. So you can see kind of the layout in the image of where all of these various nerves in the peripheral nervous system lay out. And they're designed to pull in all kinds of information for us to interpret. So but at the same time, it's also an outgoing system. So some nerves are specific to incoming information, some are specific to outgoing. They are often kind of interconnected with one another, but they're designed to send out commands from the brain to the rest of the body through what are called motor neurons. Now, to review what I already talked about very briefly, there are two parts making up the peripheral nervous system. You have the somatic system, sometimes referred to as the skeletal nervous system, and then the autonomic nervous system, which itself is broken up into the sympathetic and parasympathetic systems that we'll talk about next. The sympathetic nervous system, as I mentioned before, is responsible for getting you ready for an emergency, essentially. If your sensory systems detect something that requires your absolute focus and attention. So you're driving your car and you notice that the car in front of you has stopped suddenly. Your sympathetic nervous system is going to dilate your pupils to let in more light, contract your blood vessels, speed up your heart rate, your breathing, slow your salivation and digestion, and make you sweaty, so that you are able to act very quickly to respond to the situation. The parasympathetic nervous system, because being all ramped up like that isn't necessarily comfortable, nor is it all that good for you when it lasts for a super long time. So the parasympathetic nervous system, as you can see here, is just going to do the opposite. It's going to pull your pupils back to being responsive only to, how much light is available. It's going to dilate those blood vessels open, take your heart rate back down to resting rate, slow your breathing, and restart your digestive system. So what you have here is, sympathetic says, emergency, emergency, get the body ready for fight or flight. Parasympathetic says, there is no emergency, calm down. And that's essentially what it does for us. Now, in some disorders, you can have people who are kind of like chronically in a state of sympathetic nervous system arousal. So in some of the anxiety disorders, particularly generalized anxiety disorder, people may just be sort of persistently in a state of arousal. There's also the issue of chronic exposure to stress and the consequences of that. You have just a persistent level of sympathetic nervous system arousal, and also the persistent release of what are called stress hormones that have negative impacts on the body. So let's say, for example, you are in a chronic stress situation like having chronic poverty, or being in a dangerous neighborhood, or maybe your country is in warfare and you don't feel safe. You're going to have sort of physiological and psychological consequences of having just too much sympathetic nervous system arousal, which takes a tremendous amount of energy and can, exacerbate in a sort of cyclical way all of the other physical responses that we have to stress and danger. In the endocrine system, which involves a lot of different anatomical organs, glands, like the pituitary gland, the thyroid gland, and so on. It works within the autonomic nervous system. In addition to performing a whole bunch of other functions, it also is a part of how we respond to stress. And that's kind of what I was describing just a second ago. Since endocrine glands secrete hormones, so these are chemical messengers similar to the way you have neurotransmitters within the brain. Hormones throughout the body, they're carried in the bloodstream to specific targets to then enact specific responses to stimuli. The endocrine system, in addition to responses to stress, is also heavily involved in things like sex, eating, your metabolic rate, your ability to reproduce, and in childhood and adolescence, your physical growth. So there's a lot of things that the endocrine system is responsible for. Any kind of disruption to those things can have consequences for us psychologically as well as physically. Now, the way the system kind of lays out, you have the hypothalamus, which is part of the brain. So it's housed within the nervous system, and it responds to information that the nervous system picks up from the surrounding area, and then gives instructions to the pituitary gland. And the pituitary gland is often referred to as a master gland because it releases hormones that are essential for growth, but also it has directorial responsibility for telling the other glands what they're supposed to do. So the hypothalamus is the connection to the nervous system. The pituitary gland is then going to send out further instructions. And that just shows you kind of how integrated these systems are. In addition to the pituitary, and this graphic kind of shows you all of the connecting points, you've got the hypothalamus, which is a brain structure, and it's going to tell the pituitary gland what to do. The pituitary is the conduit for then sending out additional messages elsewhere into to direct other kinds of parts of the endocrine system. This graphic also shows the thyroid gland, the adrenals, the pancreas, in females, the ovaries, in males, the testes. The adrenal glands, which are, they lay on top of the kidneys, those are heavily involved in that fight or flight response. So they're going to send out commands, they're going to receive commands from the autonomic nervous system to kind of flood the body with these fight or flight hormones that tell the body to get ready to fight or get ready to run, basically respond to the emergency. The pancreas is involved in digestion and also blood sugar levels. So if you know somebody or you are someone who has diabetes, your pancreas is the culprit there. It's not doing what it needs to do to maintain regular appropriate levels of blood sugar by producing insulin. And then finally there are the sex glands. In females, the ovaries, which secrete estrogens, the testes, which secrete testosterone. When you think about these sex glands, however, they are not the only source of these kinds of hormones. So, in females, you have levels of testosterones that are detectable in the bloodstream. They're just significantly lower than in biological males. Same, if you flip that over for biological males, they also have estrogens, but just not in the same levels as females. Now we're going to shift focus here briefly and talk about how psychologists define and then explain human experiences of emotion. And I'll be upfront. I've always been a bit frustrated with these theories of emotion because in some ways they just don't get at the full experience of emotional life. The tendency in emotion theory has been to focus on specific kinds of emotional experiences rather than the full range of emotion. So many theorists have talked about a physical component to emotion, and that can include that sort of fight or flight response, which can be associated with fear, with anxiety, with worry, with anger, with absolute terror, whatever words you want to use for it. Those words, and in some people it can be excitement because they love that feeling of adrenaline high. So again, that the fight or flight response includes all of these physiological experiences. There's also, though, a behavioral component. And here, that's going to come from the motor neurons, where the messages about is there an emergency, or is that person really attractive, or is that thing that I'm thinking about making me nervous, that then is going to translate into some sort of behavioral expression. So there's a theory called the hypothesis called the facial feedback hypothesis, which assumes that facial muscles are actually going to communicate back to the brain. And there was this weird line of research where they had people basically sit in front of a mirror and put a pencil in their mouth in such a way that it forced the smiling motion. See, you put the pencil horizontal and then hold it in your mouth, and it kind of forces a smile, versus poking one end of the pencil in your mouth and clutching it, which forces a facial expression that's somehow a mixture of the muscles used to frown and look disgusted. And then they, asked people what they were feeling or what they were experiencing. There's also a cognitive component of emotion, what you're thinking. I mentioned before, there's some people who really thrive on adventure, excitement, and danger. And they, in fact, may be looking at situations that for others of us would terrify us. They're interpreting the situation, though, as exciting and fun, something they want to run toward as opposed to run away from. And that can either just because of their personality or their training. So, for example, if you're trained as a first responder, that adrenaline rush that you get in an emergency is something you're trained to use to do your job. And then, when the emergency is no longer active, then you come back down. It all depends in some of the emotion theories on how you interpret and understand and explain the situation that's in front of you. Now, there is what's called a common sense theory of emotion, and that suggests that, I provided this image. It's a still image from a TikTok video where this woman is sitting in her kitchen, and then there's a mountain lion kind of looking at her. So imagine, what would be your reaction to a mountain lion on your porch? A big cat, basically, that could eat your face off. So the proposal in this common sense explanation of emotion is that you have a subjective experience. If I were sitting in that kitchen and there was a mountain lion, I might initially be a little concerned, and then I would have to deal with my dogs losing their minds because they would be crashing the window and trying to get at this mountain lion, which is to them just a giant interesting cat. If the glass starts to break, then I would be in full-on freak-out mode. So you can see that I'm thinking through a subjective experience. That subjective experience of looking at that cat as a danger prompts a certain level of physiological arousal. Now, for this particular woman who's sitting in her kitchen, obviously she was like, this is interesting. I can put that on TikTok. So she whips out her phone and starts recording this exposure to the mountain lion. So in that case, her subjective experience is more excitement. It's still going to trigger physiological arousal. So the next step is, recognition of, say, a dangerous situation or an exciting situation. That's going to prompt certain feelings and reassessments. So if I'm terrified by the mountain lion on my porch, I'm going to be thinking about this as a fear situation, as an emergency that is tainted by fear. As opposed to the woman who posted the video, she was excited about it because it could get lots of hits online. So her cognitive recognition of this situation was a bit different than what mine would have been. So you see a mountain lion on your patio. If you're like me, you realize you're afraid of that cat. And then you have physiological arousal that follows the recognition that you are afraid. And then your heart races. Now, not all of the data really supports this explanation. Some theorists argue that the physiological arousal happens first, then you have to interpret it, then you take a behavioral response that is appropriate to the interpretation. Other theories are more mixed. So your authors present you with 4 broad theories of emotion. So the common sense theory, and they use the example of a bear. You can slide in a mountain lion if you feel like it. So you have the stimulus, you see it. Then you, in the common sense theory, you believe you are afraid. So you have that perception cognitively of an emotion called fear, and then the physiological arousal follows it, and behavioral responses consistent with that emotion are going to be exhibited. In the James Lange theory, you see the stimulus, the bear, the mountain lion, whatever, and they argue that the physiological arousal occurs first. Then you perceive the emotion that is consistent with it. In the Cannon-Bard theory, they argue that the physiological arousal, the behavioral responses, and the labeling of the emotion happen at the same time. And then the Schachter-Singer two-factor theory argues that you really have to separate out the cognitive component of emotion. So you see the bear or the mountain lion, you experience the physiological arousal and the automatic behavioral responses associated with it. So, your nervous system ramps up for responding to this unusual stimulus. And then you do a cognitive appraisal. So in the example I gave of how would I respond to a mountain lion on my porch, given that I live in Northeast Ohio and we don't have those creatures here, I would be pretty freaked out. So I would pretty immediately label that as A, unusual, and B, a serious problem. So I'm going to then identify what I'm feeling as fear. Now, in contrast, if I was living out where my cousins live, just on the edge of the mountains in Colorado, they see bears and mountain lions and elk and all that all the time. It's not a novel thing to see. So for them, their cognitive appraisal is, oh yeah, there's another bear. Now, the physiological arousal, if it was close to their house and like there was a bear on their patio, and their dog happened to be out, they're going to appraise that situation as a dangerous situation needing a different kind of response. So they may label that as fear. If, however, it's just an everyday occurrence of, yeah, that bear is stealing from the bird feeder again, then what they may say is, silly bear, and they will just respond to it, not with fear, but maybe amusement. Like one of my cousins sent me a video showing this, it looked to be a fairly young bear, trying to climb over their fence to get into their yard and really just not being able to manage it, and it was pretty hilarious. Now, if I saw a bear trying to climb my fence in Northeast Ohio, yeah, there are some bears in Ohio, but not in the suburbs of Plain Township. I'm gonna be pretty scared about having a bear in my backyard, right? In contrast, if a deer, standard Ohio white-tailed deer, shows up, I might have some physiological arousal to that because I don't see the deer every day. They show up every now and then, and I usually appraise that situation as totally a non-emergency and an opportunity to take cute pictures or videos. So what I feel in that situation is amusement, joy, opportunity, and a chance for my dogs to be super happy because they get to look at something new. And that concludes part 3 of chapter 2.